And next up is Bron Kisler.
You don't have to read it all.
Bron works as part of the US NCI, National Cancer Institute, but he's also been involved in a number of standardization, including CDISC and the ISO Health Forum. So Bron, take it away.
Thank you. So I've been with the National Cancer Institute as a contractor just for 1 year and 3 months now. Before that, I was with CDISC. I was one of the original founders of CDISC. So it's interesting, me sitting in an audience watching a CDISC presentation. So this is my first large public presentation, not CDISC, this being with NCI. So I am, first of all, my role with the National Cancer Institute. So I'm a contractor with CBIT, the Center for Bioinformatics. And I work under 2 large programs, Enterprise Vocabulary Services Program and the Cancer Research Data Commons, or CRDC. I also have another role in ISO Technical Committee 215, and that's going to be the focus of my presentation here today. And I'm a convener of one of the work groups, which I will talk about. I am a data standards expert, a data standards junkie. I've been doing this since 1997, so working with Peter for, 15 years in CDISC. I've been a member, active member of HL7, I think going on 12 to 13 years now, and I've been with ISO Health Informatics for six or 7 years. Let's move on. So I'm going to focus on, so if you all have heard about ISO, the International Standards Organization. So ISO out of Geneva is made up of many different technical committees. Today I'm just going to focus on one, Technical Committee 215, which specific mission and scope is around health informatics. So it was founded in 1998, and it's about standardization in the field of health informatics to facilitate consistent interchange and use of health-related data and information across the whole healthcare system. And once again, think about the scope. Health informatics is where we're focusing. Secretariat. So I have to get into a little ISO jargon here. So TC215 is made up of 31 participating countries. Only one country of those 31 countries can be what's called the Secretariat, or hold the chairmanship of TC215. That chairmanship sits in the United States and is led by Mike Glickman. Anyway, and so the organization that will provide the administrative support is actually changing. So you'll see there, ANSI, the American National Standards Institute, in December 2018, will be taking over ownership of that, which I think is a good home. Previous secretariats have been HIMSS, which you're all familiar with. So membership in TC215. TC215 means we have over 200 people participating. Out of 31 participating countries, we usually get between 22 and 25 at different work group meetings. And it depends on where in the world they are, so you get different mixes of countries and experts. So deliverables, I'm not going to dive into these in details, but TC215 has 3 primary deliverables. You have an international standard, which is kind of the highest profile. You have technical specifications, and you have technical reports. To talk a little bit about the process, so coming from CDISC, where CDISC, we had a very rapid process for getting new standards in the marketplace, about 18 months. ISO has a much more formal and rigorous process. Lots of checkpoints and steps that have to be approved by those 31 countries before a standard can move on to the next level. So you start with what's called a preliminary work item. That's when an expert in the world brings forth a new project idea. That new idea has to be approved by the 31 countries, okay? And what is interesting in the ISO world, when I say participating countries, so if you have 25 countries in an ISO meeting, it's one country, one vote. So you can't stack the votes. So the United States may have 25 experts at an ISO meeting. Japan and Korea may have 10. Switzerland may have 2. Guess what? We all get the same vote, which is it's actually pretty cool. So it's like the United Nations. Anyway, so to get from a PWI, when that's approved, to a final draft international standard, or FDIS, it can be 24 months, 36 months, or 48 months. And that's decided by the project lead and based on the complexity of the project and the standard. So just like I think Bob was talking about HL7 and all the different work groups. So same with TC215. We have 6 different work groups and task force and committees and joint work groups. I'm focusing today on work group 2. So I'm the chair of work group 2 in TC215, and it's systems and device interoperability, and that's where all the TC215 health informatics genomic standards are coming into. So this is what a TC215 meeting looks like. I think this was a year ago. Do I have a pointer here? I do have a pointer. You recognize this guy right here. That's Rishi. This was the first time that TC215 and GA4GH got together. So about a year ago now. It just happened to be in Liverpool, and there was some email communication going on, and Rishi came. And I'll talk a little bit more about that discussion. But anyway, so you get about 200 people from around the world, Europe, Asia, North America, South America, Australia, all around the world. And they're meeting and doing work, rolling up their sleeves and doing work in work groups for about 3 days. And then all those proposals, so if you want to propose a new project or you want to move a project to the next level, that happens in the closing plenary. And that's where all the countries vote. So all these proposals and resolutions are voted on at the end of the week. And if your thing doesn't pass, guess what? You have to start all over again in 6 months. So it's a very interesting process. So once again, so we have 8 genomics projects happening in Workgroup 2. 4 of them come from Korea, 3 from Japan, and 1 from China. And once again, these are the project experts. I'm just going to touch on these at a high level. So Korea, all their genomics projects are technical specifications. Su-Young Chen from China leads the first 2, so data elements and metadata for describing structured clinical genome sequence information and EHRs. And that's a published standard. That's already published. The others are in various stages of development, which is good, so that there's opportunity for GA4GH and ISO TC215 to work together on these if there's significant overlap. The next project is Structured Clinical Gene Fusion Report in Electronic Health Records. We have quality control metrics for DNA sequencing, clinical genomics data sharing specification for next generation sequencing, NGS. So those are the projects from Korea. 3 projects from Japan. Those are led by Yun Nakaya and Soichi-san is here somewhere. I don't know where. Anyway, there he is. So we have one of our Japan project experts here, and I think Jun Nakaya, Yun-san, attends GA4GH meetings as well. So once again, we have some expert overlap, which is great. And then we have 1 new project from China. I'm not going to go to this in detail, but this just shows, the flow of information in genomics down through the data processing and all the way to transfer into clinical practice and EHRs. So the first 2 standards that I talked about, led by Su-Young Yen, they sit over there on the left-hand side, and they're focused on the EHR, genomic information in the EHR and in clinical practice. And then the final standard that I went through, that one is about data sharing. So how do you get the information from a clinical researcher or a hospital facility or a patient health record or the FDA? So that's about the sharing. So I'm just going to hit on the 2 Japan projects at a high level. We have the omics markup language. That's about data exchange format for omics data. And this is basically the format and the structure for the OML. We have the whole genome sequence markup language, which is data exchange format for the whole genome sequence data. And I'm sure there's probably significant overlap here with things that are going on in GA4GH. I just don't have the knowledge of GA4GH, so I'm going to have to rely on you all to tell me where the touch points are and where we need to work together. So we had Rishi come to see us a year ago. And I don't know why he was hiding there, but he's hiding behind the paper. And this was the first CrossSto Genomics meeting for ISO TC215 and GA4GH. And when Rishi came, what we did is I split up work group 2 into 2 work streams. And I said, somebody else, you run all the other stuff. I'm taking the genomics experts and Rishi, and we're going to sit together for a number of quarters. So Rishi got to hear about all the projects from Asia directly from the project leaders. And then Rishi gave us an overview of GA4GH and talked about the driver projects and the work streams. So that was the first time a lot of people in this community, we knew about GA4GH, but we didn't understand how it worked. So this is an important inaugural process. And also why this is important. So I have to give big kudos to the chair of TC215. His name is Mike Glickman. So Mike Glickman has set a very strong precedent that TC215 will work with other open standards organizations wherever possible. We do not want to work in a vacuum. We want to collaborate and we want to coordinate. So this is an example of that. I will give you one more example because I think it's important for you all to hear. So CDISC and HL7 had worked on a standard for a number of years with the National Cancer Institute called the Bridge Model. So the Bridge Model had been balloted through CDISC and HL7 a number of times, but the Bridge Model is now also a TC215 standard. So what that means is when we come out a new release of Bridge, like version 5.3, we align those ballot cycles. So the new version of Bridge will undergo a simultaneous CDISC, HL7, and ISO ballot. And so we're able to bring comments together from all those standards communities and just makes a better standard. So I just want to give that as an example of an ISO technical committee working with open standards organizations and how that works. So next steps. The next TC215 meeting is in a couple weeks in Italy, so I will go and report about what I've learned here at GA4GH and the CrossSto discussions, and I will report there in Italy. We will continue to progress, obviously, the Work Group 2 genomics projects, keeping in mind, obviously, what I've learned here at GA4GH this week, because we want to make sure we're working closely with GA4GH. We don't want to go this road alone. Actually, none of us want to go the road alone. Genomics is growing too quickly. We can't all do everything. So we need to be working together and coordinating. And it's not easy. I mean, there's willingness to coordinate, but putting that into action and setting dates and milestones, it's important. January 2019, we will have another CrossSto discussion. HL7 has offered a room for the day. So we'll have GA4GH, HL7, ISO, CDISC, NCI, and SNOMED. Another important date that I'm shooting for. This is selfish, but important. April 2019, so that'll be the next TC215 meeting. What is happening in Work Group 2 is we're getting all these new genomics projects now, but TC215 doesn't have a large wealth of genomics experts because we hadn't been focused on genomics. So I had about 5 countries come to me, actually call me in the last month or two and said, have you ever thought about making genomics a subcommittee? And I said, okay, so why do you want a subcommittee and what does that mean? They said, well, we're not going to bring genomics experts all the way from Australia for 2 quarters in a Work Group 2 session. But if you create a subcommittee on genomics that runs for 3 full days, we will bring you all the genomics experts you want. And so in the ISO world, I'm sorry, I'm getting into some ISO language, you have a technical committee at the top, that's TC215. You have the work groups and task forces here. Subcommittee sits right in the middle of the two. Subcommittee is run parallel with the TC, and it allows you to focus on a specific area and to focus experts on a particular area. So I'm really excited about this. In closing, because my day job is National Cancer Institute, I think it's important to point out. So there's the National Cancer Institute Enterprise Vocabulary Services, or EVS, which has the NCI Thesaurus, which is an open standard terminology. This is also important for this group to understand here. So NCI Thesaurus right now is getting close to 150,000 concepts and terms. Most of those do have full text definitions, and we have over 1,000 value sets. Value sets means bundling of terms with fields. When you think about NCI Thesaurus, a lot of times people think, oh, well, NCI Thesaurus is only for cancer. That is not true. NCI Thesaurus is used all around the world for many different use cases. Obviously, NCI, NIH, Peter was talking about the regulation of CDISC. NCI Thesaurus terms are CDISC terms. So there's 35,000 NCI T terms and codes that sit in those required standards, going to the Food and Drug Administration as well as Japan PMDA. And Peter and I were talking last night, now China's looking at CDISC standards that will also include the packaging of NCI Thesaurus. One thing I would note, you see that we've added, the EVS team has added 14,000 terms in the last year. Guess where most of those terms are coming from? They're coming from clinical trials, clinical research, but also genomics research. in the growth in genomics projects because it is an open terminology standard. So Genomics Data Commons. So NCI has a working relationship with Genomics Data Commons. That is a driver project here. So I'm not going to tell you what GDC is, but I'll tell you how many of the genomics data sources that are going into the Genomics Data Commons are already coded in NCI Thesaurus. So such as TCGA, the Cancer Genome Atlas. So when that data was submitted and put in GDC, it came with NCT codes, okay? EVS also has a direct working relationship with GDC and the University of Chicago. And the EVS team recently took their data dictionary, the whole GDC data dictionary, and we coded it, we gave them terms and definitions. So that's why you're seeing the growth in terms. One last thing. This is a makeup of EVS. I only want to point out one thing on here, not to make you dizzy. I did not want to do that. Right here. NCI term suggestion form. You can go to the NCI website, NCI Thesaurus, NCI EVS. Anybody in this room can request terms that will be evaluated for coding and definitions. So if you're working on a genomics research project or a clinical research project, you're interested in NCIT terms, and you don't find the term that you need, you put in the request. It doesn't have to be a single term request. CDISC sends us hundreds of terms that are required for regulation at a time. So just want to let you know, this is an open process, and anybody in this room can participate in this. Thank you very much, and thanks to Bob and the steering committee for inviting me.
Great.